Welcome to Every News. The future of U.S. healthcare in 2025. What's changing? What's collapsing? And what does it mean for you? From shocking government reforms to exploding drug costs, this year could define the next decade of American healthcare. In March 2025, the U.S. government announced a major overhaul of the Department of Health and Human Services. 5 agencies were merged into a single super agency, the Administration for a Healthy America. But that came at a cost. Over 20,000 government jobs were cut. The CDC and FDA are now operating with 20% fewer staff, raising concerns about pandemic readiness and food-drug safety. At the same time, a new federal tax bill reduced Medicaid and Obamacare support, which could leave up to 17 million Americans uninsured by 2034. Healthcare is getting more expensive. Fast in 2025, the U.S. is spending over $7 trillion a year on healthcare. That's more than the GDP of Japan. A big reason: expensive new drugs, especially GLP-1 medications like Wegovy and Zepbound for weight loss and diabetes. These drugs are life-changing, but budget-breaking. Half of large employers now say they may have to cut benefits by 2026 just to survive these rising costs. With hospitals overwhelmed and staff stretched thin, the healthcare system is moving fast toward outpatient and virtual care. Think telehealth, urgent care clinics, remote patient monitoring, even surgery centers outside hospitals. And mental health is finally becoming a serious part of treatment plans, with new whole-person care models blending physical, emotional, and social support. AI is transforming healthcare behind the scenes. From scanning X-rays to handling paperwork, AI is saving time and lives. Healthcare executives now rank AI and automation in their top 3 priorities for 2025. But critics warn there's little regulation. Some fear misdiagnoses, data leaks, and algorithmic bias. That's why new rules like Tripod AI and Decide AI are being pushed to make AI safer and more transparent in hospitals. There's another silent crisis: America's caregivers. Over 63 million. People care for loved ones without pay or training. They're exhausted, overwhelmed, and often ignored. Doctors and nurses, too, are burning out. Virtual simulations and AI-powered tools are now being used to train nurses faster. But will that be enough? Meanwhile, more doctors are pushing back against corporate hospital takeovers, warning that private equity is hurting patient care. So, what's next for us healthcare? More automation, more home care, more tension between cost and compassion, and possibly more Americans falling through the cracks. Stay informed. Stay empowered. Subscribe to EVERYNEWS for the truth behind the headlines. Thanks for watching. And let us know in the comments, what scares you most about the future of healthcare?